Possibility that the law could soon be suspended. Joining me now on what this means for women's reproductive health across the nation is reproductive justice expert Dr. Alisha Leggett. Thank you so much, Doctor, for joining us here on BNC. Since the original Texas measure became law, it triggered new concerns about heartbeat laws and women who may wind up doing desperate and dangerous things to their bodies to terminate unwanted pregnancies. Do you think that's the case here?
Absolutely, absolutely. I think behind these laws and the policies that we are hearing about from the Supreme Court and these challenges in the court system are human stories. There are individuals who are making difficult decisions about their bodies and about their health and for their families that really should remain private between them, their families, and their doctors. People in some cases will go to very extraneous means to be able to obtain an abortion if it means that they can feed their family, if it means that they can continue to live a quality of life for their families that's important to them. So and this has been something that we've seen throughout history, that when and also in other countries as well, that when we have restrictive abortion laws, that we see higher rates of individuals seeking abortions illegally, which in many cases are very unsafe.
Now, in response to the SCOTUS ruling, we've seen California's effort to become a sanctuary state if Roe v. Wade gets overturned. Do you expect to see more states doing the same?
Yeah, I mean, I think this is absolutely amazing that there have been these measures put forth in an effort to try to combat this issue of women not being able to obtain access to basic health care, and abortion is a basic health care right. It's important that we as a country can support all individuals in order to support to live their best life and to be their healthiest. In terms of seeing other states replicate what California is doing, I think that really remains to be seen. I think it's going to be an issue of resources and, more importantly, an issue of public will. How important does the public see this as an issue, a right that needs to be protected?
So, what other actions would you like to see long term to provide protections?
Absolutely. In addition to these court rulings and laws and policies that really protect individuals' rights to obtain a safe and affordable abortion, we also need to utilize technologies in some cases to provide abortions. There's medication abortions as well as procedural abortions, and we can utilize technology in order to really leverage that and expand access to abortion. We also need to increase the number of providers that are willing to provide this service in an effort to increase access as well, to really incorporate this more readily into medical training such that people feel comfortable providing this service, even in a primary care setting. There are various ways that we can attack this issue at a systemic level to really combat the issue of access to abortion and to reduce the stigmatization around abortion, particularly as it relates to basic medical care, which it is.
Yeah, and Doctor, I actually want to ask you about what happened earlier this week with Vice President Kamala Harris. She hosted the first ever Maternal Health Day of Action. So, what does this mean for the thousands of Black and Native women who face high maternal mortality rates?
Absolutely. I think this is, and it's an amazing opportunity to acknowledge that these disparities in healthcare among women of color, Black, Indigenous, and other women of color exist, and individuals of color exist, that the federal government is recognizing that there needs to be resources allocated in order to combat this problem and in order to raise awareness. And I think most importantly, mechanisms in place to ensure accountability when quality measures are not met and when there are adverse outcomes. So this is a very
So,
important
as a
and
doctor, real quick before I let you go, as a reproductive justice expert, what steps would you like to see both on the federal and local levels to protect women of color who are expecting?
Absolutely. I think one of the most common complaints that I hear from women of color in my practice who are both pregnant and or seeking reproductive health options is really just feeling heard, validated by their physicians, by their providers, and as a result, are victims of implicit bias and fall through the cracks. Right. So there really needs to be more accountability for the mistakes, for the oversight, for the bias, for the perpetuation of racism that exists in our healthcare system. We need accountabilities, we need measures that really are looking um, at this issue from a data standpoint, and of course, resource allocation, monies, so that we can put programs in place for not only training providers in the issues of maternal health, but also implicit bias, and providing more support to providers as well who may experience burnout and thus are more likely to perpetuate these cognitive shortcuts that can give way to differential treatment and differential care.
Well, hopefully, with Vice President Kamala Harris and her Maternal Day of Health, things will start changing. Thank you so much, though, for your expertise. We appreciate you joining us, Dr. Alisha Liggett. We appreciate you joining us here on
Thank you so
VNC.
much.